So first, talk a little bit about vaccine distribution basics. Vaccines are developed, of course, by companies, and transport is mediated right now by Operation Warp Speed, initiated by the federal government, with logistical assistance ultimately to states. In Virginia, the Virginia Department of Health is currently responsible for allocating a very limited supply of vaccine to localities, who then, of course, manage vaccine administration. So who distributes at the locality level? For the initial phase of vaccine rollout, which was aimed at healthcare personnel, the 1A group, which I think we're all familiar with, the primary recipients were hospital systems and health districts. The original plan was predicated on healthcare systems managing the heavy lift of vaccinating 1A individuals, with health departments serving in a support role. There's been variable response by health systems across the state. In the central region, which includes the Metro Richmond area, health departments have had to assume the primary role of vaccinating healthcare personnel not affiliated with healthcare systems. In addition, there is a growing list of pharmacy partners and providers to whom we can distribute vaccine to dispense. We are tapping that resource heavily while supplies are growing. So how do we determine who gets vaccine? Expecting the vaccine supplies would be low in the early stages of rollout. The Advisory Committee on Immunization Practices, which is a federal entity, established priority groups based on risk of adverse events from contracting COVID or the risk of critical infrastructure loss in the event of widespread employee exposure to illness. So the broader 1A, 1B, and 1C groups were established, and the Virginia Department of Health further defined who would be individual by each of those subcategories. Finally, ensuring a consistent vaccine supply has been a significant challenge and hasn't kept up with the accelerated pace with which we've been tasked with to move through the phases. Health districts were directed to enter phase 1B literally one week ago on January 18th, which includes roughly now half the state's population, so a very broad category to cover. Consequently, alongside all of that, vaccine supply collapsed more or less at the same time. So as of this past week, the state is expected to receive about 100,000, a little bit more than 100,000 doses of vaccine per week. The new plan instituted last week was for health districts to control the distribution of vaccine, which will be allotted to health districts on a per capita basis. So this health district will receive 4,625 total doses each week. I was informed day before yesterday that our next allocation will be reduced by 100 doses. So we're expecting 4,525 doses total this coming week. So the basic rationale is that health districts would have a pretty good idea about how to allocate this very limited supply based on need. The current estimates are that we could be about 6 to 8 weeks away from improved supply. I mean, those are estimates only at this point. So dose allocation totals have been offered, that 4,525 dose allotment per week, to give us a 4-week planning time frame. So below, you'll see the breakdown of how this week's allocation will be distributed by population group here in this health district. So we settled on these 3 groups either because of vulnerability to adverse outcomes or, again, the critical nature of the work they perform. So it includes more direct allocation to seniors than we had been as we then jumped into 1B, which will certainly, of course, be expanded. A portion to essential workers, and an amount we believe will cover most of our remaining 1A population. 1A, again, is the healthcare personnel. Below that, you will see another list which further defines the essential worker and senior population categories who we're aiming our vaccination efforts at this week. Individuals over the age of 75 have the highest risk for COVID-19 associated morbidity and mortality, and individuals 65 years old and older with an underlying health condition have a higher risk of morbidity and mortality risk as well.
And just to set those expectations, we've heard government entities throughout the country with days and weeks, but we're not talking about weeks, we're talking about months, isn't that correct?
Well, to cover the whole 1B population, given the doses that we have, I think that is a very fair assessment.
I just think that one of the reasons why we're having so much feedback is that expectations have been set much greater than can actually be obtained, and that if we can just be honest with each other, and this is where we're really at, this is what we're really facing, and these are the numbers of people that we need to take care of, that clarity will help some people to understand, because there's citizens that believe that there's plenty of vaccine out there, and they're just not able to get it here, but they can get it somewhere else. And that's not really what's going on in the state, but it is the perception of our citizens, and we need to change the perceptions and expectations of our citizens to something that's more real. And that's not something that we want to do and something that we want to share, but it is what they need to know so that we can all work together moving forward.